Done. The warring parties remain locked in a zero-sum military logic, while greater international attention and action is urgently needed to change that calculus. What is clear, the message delivered to the UN Security Council by senior UN Secretariat officials during a meeting convened to discuss the deteriorating humanitarian consequences, including the protection of civilians, as a result of more than a three-year conflict. Often overshadowed by the wars in Gaza and Iran, the Council heard that more than two-thirds of the people of Sudan are in desperate need of life-saving support, Sherwin Bryce Peace reports.
The numbers present a stark reality. 13 million people have fled their homes, including 8.7 million who are now displaced internally across all 18 states. The death toll since the April 2023 start of the war between Sudan's armed forces and the paramilitary Rapid Support Forces estimated in the hundreds of thousands, while sexual violence has been prolific. Under-Secretary General for Political and Peacebuilding Affairs, Rosemary DiCarlo.
Brutal mass killings and atrocities, abductions of women and girls, and mass rapes are recurring patterns. Since the start of the conflict, the Office of the High Commissioner for Human Rights has been able to document 838 victims of sexual violence, almost all women and girls, but these figures may only be the tip of the iceberg. Drones launched by both sides have repeatedly struck markets, schools, fuel stations, and water infrastructure. Civilians face the unrelenting consequences of one of the worst humanitarian crises of our time.
The fighting characterized by persistent violations of international humanitarian law, the heavy use of drones, localized ground combat, displacement, the spread of disease, food insecurity, and systemic sexual violence. Listen to Dr. Eva Kerr, a British Sudanese health protection and peacebuilding advisor.
Horrific sexual violence is being reported in 16 out of 18 states. Rape and gang rape, sexual slavery, forced marriage, forced pregnancy, forced prostitution, sexual torture and trafficking, primarily but not exclusively perpetrated by the RSF. Sexual violence is not simply a weapon, but a deliberate strategy to terrorize civilians and control their movements. Where ethnically motivated, it is used to persecute, displace, and destroy communities. Many women and girls do not report sexual violence due to lack of adequate services, risks of reprisals, and social stigma. Abductions linked to sexual violence and forced reproductive labor have become key to the war economy. We must not neglect intimate partner violence and domestic violence, which conflict, displacement, and economic crisis only intensify.
As the Council and the broader international community's role in ending this conflict also came into sharp focus with these reflections from Tom Fletcher, the UN Under-Secretary General for Humanitarian Affairs.
The ask is that we do not have another meeting where the Council simply describes the problem. Sudan does not suffer from a lack of analysis. It suffers from a lack of action. The people of Sudan need food, water, and medicine. Yet the world sends drones, weapons, and mercenaries. The people of Sudan need sustained, courageous diplomacy. Yet the world is too often indifferent and distracted. The people of Sudan need peace and dignity. Yet others use Sudan's land and people as pieces in a regional struggle for power, gold, and pride. This council is not powerless. The international community is not powerless. The tragedy of Sudan is not that we do not know what to do. It is that we have not yet found the will to do it.
The Council also heard that the United Nations continued to support the efforts of the Quad, comprising the United States, Saudi Arabia, Egypt, and the United Arab Emirates, towards a humanitarian truce. This while the principals of the African Union, IGAD, the League of Arab States, and the European Union were due to travel to Sudan in the coming weeks to explore synergies between domestic and international efforts towards advancing peace. But after 3 years of war, the conflict has become more complex, with growing political polarization, territorial fragmentation, and the continued external flow of arms into this war. finding common ground is now likely to prove even more difficult to achieve. I'm Sherwin Bryce Pease in New York.
Brings the time to 15 minutes past 7. So the Ebola outbreak in the Democratic Republic of Congo has now passed 5,200 cases as the country marks 100 days since the outbreak was declared. The World Health Organization says this is the country's fastest growing Ebola outbreak, with transmission continuing to outpace efforts to contain the virus. The outbreak has now spread to a sixth province, while Ituri remains the epicenter, accounting for around 85% of cases and 79% of deaths. The response is also being hampered by insecurity, displacement, and difficulties of access to affected communities. For an update on this, we're joined by Dr. Patrick Otim, Regional Manager for Emergency Response at the WHO Afro Desk. A very good morning to you, Dr. Otim, and thank you so much for speaking to us. 100 days since the outbreak. Let's just start with what some of the major difficulties you're facing are, because we get reports of protests in the DRC over what some of those protesters call misinformation.
Thank you very much, and good morning to the listeners. Yes, it's we're now past the 100-day mark in this response. It's unfortunate that also we are looking at very high and unprecedented number of cases, actually having now passed the 5,500 mark, and also over 2,300 deaths that have been recorded. But we are also encouraged by the fact that we have over 1,200 people that have recovered, testament to the hard work of all the responders on the ground. Yes, the response continues to face a number of challenges, and the number one has always been the issues of misinformation, the myths that fuel the community response, which has always been initially a bit indifferent to the response, but progressively has been picking up. We still have pockets of challenges where the population still do not believe in that this is an Ebola outbreak, and some of them are not coming early enough to the treatment facilities, resulting in the community deaths that you referred to. And we also have instances of violence against the responders, which significantly curtails our efforts to respond in some of those locations when this does occur. Of course, we also have areas of conflict and insecurity, which also further hinder access in places like Nyanya and PK51, which has been now the one feeding transmission to other locations like the new province that is Baziwele, which has been impacted. So it's been a combination of a limited support and cooperation from some pockets of the population, the insecurity and access challenges, which has really been the major hindering block to rapid scaling up the response.
And just the resistance that you say you're encountering, because I see that more than half of the deaths are occurring in communities rather than treatment centers. Are people refusing to take their loved ones, or themselves refusing to be admitted to these treatment centers?
So when we see community deaths, definitely one of the things that we look at is that, and which has been the number one we have received from engagement with the community and listening to rumors, social listening. One of the things has been that there are those who do not believe that this is an Ebola outbreak. They believe it is a curse or due to other conditions, so they don't see the need to be able to come to the treatment facility. But the other issue that is also the misinformation and misunderstanding of what we are dealing with. One of the things is that when we say that this particular virus does not have a specific approved treatment or medicine, if we can say, or cure for it, it doesn't mean that when a person is sick, there is no support that can be provided for this person. So there's that differentiation, which sometimes for the population can be a little bit confusing, because for the Bundibujo virus, what we are doing is the supportive care, which is very, very important in enabling this person to recover. So the absence of a specific antiviral for this disease does not mean that people who are brought to the treatment center will not be cared for. They will get round-the-clock care and the supportive care that their body needs to be able to fight this virus. And that's why we have had over 1,200 people recovering. So that's the messaging that we are also trying to get across, that the absence of a specific antiviral or cure for the virus does not mean that you should stay at home and do self-medication or other things, that you need still to come to the designated treatment centers where you can be supported. And that message has also been now reaching a number of people, and there's a change, but it has still not reached the level where we would expect to see that somebody presents on the first day of symptom onset, which would help us to see an increase in the number of people recovering.
And I'll talk about what the ecological differences are in Ituri in just a moment, but I am curious, when you say self-treatment, are people using, I don't know, organic traditional medicine to treat themselves? Have there been instances of this being reported, and how widespread is this practice?
Thank you. Definitely, when a person is sick, they will always seek for some kind of remedy for the symptoms or they're dealing with. So there are usually three. There are those who will go for traditional alternative medicine, which they try, which is also common, using traditional healers and other local herbs. There are those who will seek the religious route to try to get prayers and support. There are those who will approach the conventional medicine, but others prefer to do self-medication, buying all sorts of medicines to do symptomatic management at home. And then there are those who will come to a designated treatment facility. So we have also seen issues of people self-medicating, buying all sorts of things, paracetamol to manage their fever, but in a context where they continue then to spread to other people in the house. And we are trying to discourage that and encourage that, because this is a highly infectious disease. People need to come to designated treatment facilities where they can be safely managed. By doing that, they are also protecting the families and the rest of the people in the community.
So, as we mentioned, that the epicenter of the outbreak still remains Ituri, and I'm wondering, is there a difference in terms of the ecological transmission of the disease in Ituri, and what makes it difficult to break that concentration?
Yes, Ituri still remains largely the epicenter, accounting for more than 80% of the cases that have been reported, and actually the deaths. And if you look at it, it's likely around 6 health zones which account for most of the cases that are coming from Ituri. Now, Ituri, as we have explained previously, has a number of things that's unique about it. One is that this is a province that has been in conflict for some time, since 2021. And because of that, you have displaced population, you have a degradation of some of the response capacities that were there, which would have helped to quickly detect and manage this. Ituri is also an area where there's a lot of mining activity and there's a lot of movement. So the population there are highly mobile, and sometimes they are not from within Ituri. And that's why you see the spread to other provinces. So they may come to mine, and then when they fall sick, they go to the areas where they came from, or they may move from one health zone to the other. So that high mobility has been contributing to the specificities of the challenges that Ituri has. And then, of course, there are also those areas of insecurity which you are not easily able to access. So that, compounded with the fact that we've had some low level of community resistance in different areas, then makes Ituri a little bit challenging. And some of the areas like Bunia, for instance, Rwampara, those are also urban areas, densely populated. And so you have a transmission happening in very densely populated urban areas with mobile population. So all those factors makes it a little bit challenging for Ituri.
All right. Thank you so much for speaking to us and sharing with us the latest. Much appreciated. Dr. Patrick Otim, Regional Manager for Emergency Response at the WHO Afro Office, giving us an update on the Ebola outbreak. 100 days of the outbreak since the DRC, and more than 5,500 cases, as he mentioned.
You like what we do on Channel Africa? Then follow us on our socials